Malnutrition is the underlying driver behind half of all deaths of children under the age of 5. The damage scales up rapidly to the national level. Individuals suffering from chronic undernourishment lose about 10% of their potential lifetime earnings. For a country like India, that translates to a 2 to 3% drain on the entire gross domestic product year over year. Solving this requires navigating a paradox known as the double burden, a landscape where severe undernutrition exists alongside a rapidly rising wave of overnutrition. Almost 1/5 of Indian infants are born with dangerously low birth weights. In disadvantaged communities, mild to moderate undernutrition stunts physical growth and causes wasting, trapping millions in a cycle of severe protein-energy malnutrition. Simultaneously, urban populations are experiencing an explosion of obesity and non-communicable diseases like diabetes and hypertension. Sedentary lifestyles and easy access to highly processed foods have created a distinct, growing nutritional crisis. When a government has to fight mass starvation and an obesity epidemic at the same time, writing individual diet plans is ineffective. The solution requires a broader medical framework. This is where the public health nutritionist steps in. While a clinical dietitian works with a single patient to manage specific health conditions, a public health nutritionist treats the aggregate. They design interventions for entire populations, treating a community as a single organism. Their work requires blending biological science with social and managerial sciences. They have to understand how food interacts with human biology, but also how poverty, culture, and policy dictate what reaches a family's plate. To heal a population at this scale, these experts must trace physical symptoms back to their structural origins, uncovering the specific socioeconomic breakdowns that cause a community to fall ill. When a population's diet lacks sufficient calories and protein, the most visible outcome is protein-energy malnutrition. In its most severe forms, this manifests as extreme wasting away of the body, known as marasmus and kwashiorkor. There is a quieter, equally destructive epidemic running parallel to this, called hidden hunger. This happens when a diet provides enough calories to survive, but lacks the crucial trace minerals and vitamins required for the body to actually function. Iron deficiency impairs a child's cognitive function and memory. Vitamin A deficiency destroys healthy epithelium and vision, causing night blindness. This also cripples the immune system, creating a feedback loop where malnutrition invites infection, and infection deepens the malnutrition. Then there are iodine deficiency disorders. Iodine levels in food rely heavily on local soil quality. When it's missing, visible symptoms like a goiter, a massive swelling of the thyroid gland, become common. The invisible damage is worse. Lack of iodine during pregnancy leads to irreversible fetal abnormalities and mental retardation. While these conditions look like straightforward food supply issues, tracing the path of the disease reveals a tangled chain of societal failures. This model maps the specific factors of undernutrition. By starting at the physical outcomes, malnutrition, disability, and death, and tracing the web upward, we can identify exactly where the system fails. The first tier reveals the immediate causes at the individual level. This is where inadequate dietary intake directly collides with biological conditions, like active diseases or infections draining the body's resources. The next tier shows the underlying causes at the household level. Here we find poor maternal and child care practices, inadequate health services, and a lack of baseline education. This layer is also where sanitation infrastructure breaks down. A significant portion of rural households lack access to proper toilets and safe drinking water. Waterborne diseases tear through these communities, stripping the human body of vital nutrients just as quickly as starvation. Finally, at the very top of the web, we hit the basic causes. These are the societal bedrock issues: the availability of financial resources, agricultural policy, political will, and deeply ingrained cultural inequalities. Distributing surplus grain is ineffective if the child eating it is battling a parasite from contaminated well water. The entire environment must be treated. To dismantle this web, public health nutritionists deployed two main tactical strategies. The first is the nutrient-based or medicinal approach. This involves giving targeted, short-term supplements, like doses of vitamin A drops or iron and folic acid tablets, directly to high-risk groups. It works quickly, but it is expensive to sustain. It requires constant medical intervention and doesn't establish long-term changes in a community's daily habits. That's why the long-term goal is a shift toward food-based approaches. By improving food security and encouraging dietary diversity, policymakers create a highly cost-effective, permanent fix. The most successful example of this is universal food fortification. By adding iodine to a daily staple like commercial salt, the government achieves mass coverage against hidden hunger without requiring consumers to change their behavior. To permanently cure a nation, policy must move past temporary medical interventions and embed the solution directly into the local food supply. These strategies are executed through coordinated safety net programs. Initiatives like the Integrated Child Development Services and Poshan Abhiyan push these interventions down to the district and village level. They specifically target the weakest links in the biological chain, focusing almost entirely on pregnant and nursing mothers, infants, and children under 6 years old. Even these direct health programs rely on indirect policy instruments working in the background. Generating wage employment, implementing land reforms, improving women's education and social status are all required to keep families fed and resilient. Eradicating malnutrition requires the total, organized effort of an entire society. A country's economic and political future ultimately depends on ensuring its most vulnerable citizens have the environment and the resources to thrive.